Thanks for inviting me. My name is Dr. Catherine Siguas. It's a great pleasure and honor to be here. Today I'll be talking about viruses and the risks of lung cancer prevention and treatment. Introduction. Smoking is the main risk factor for lung cancer. Other risk factors included exposure to asbestos, domestic use of biomass fuel, environmental pollution, genetic factors, and chronic disease. Example, asthma, bronchial crisis, emphysema, and HIV. Also, mycobacterial infection, pneumonia, and chlamydophil pneumonia infection. Recent reports suggest that viruses such as HPV, Epstein-Barr virus, and measles virus might play a role in relation to lung cancer. SARS-CoV-2 also produces an exacerbated immune reaction and lung injury that could induce long-term tumor genesis. Lung cancer in Europe. In 2020, it was estimated a total of 318,327 new cases of lung cancer were diagnosed in the 27 countries of the European Union. In total, 64% of cases were diagnosed in men and 36% in women. The lifetime risk of developing lung cancer in people at 0 to 74 years is 1 in 19 in men and 1 in 37 in women. A total of 257,293 people died for lung cancer in 2020. And lung cancer is the leading cause of cancer death in men and the second in women, both in Europe and worldwide. Viruses and their relationship with lung cancer. Data were analyzed from the International Agency for Research of Cancer Global database, which provides estimates of incidence and mortality rates for 36 types of cancer and included data from 185 countries. The report approximately 2.2 million cancer attributable to infection in 2018 worldwide. The age standardized cancer incidence rates attributable to infection was 25 cases per 100 million person years. The main infection agents related to cancer were Helicobacter pylori, HPV, hepatitis B virus, and hepatitis C virus. Interestingly, ABV, HPV, HCV, and HBV have previously been shown to be the four major cancer-associated viruses. Table viruses relate to lung cancer and propose mechanisms of oncogenesis. Virus, human papillomavirus, potential mechanisms of oncogenesis in lung cancer, A6 and A7 proteins target P53, and BCL2RRB, disrupting the cell cycle and apoptosis. Level of epidemiological evidence. high HPV genome found in tumor genome, meta-analysis indicating greater risk of lung cancer in HPV positive subjects. Other Epstein-Barr virus, ABV, potential mechanism of oncogenesis in lung cancer is the model of oncogenesis suggests previous premalignant lesion and type 2 latency and active of ABNA, LMP1E, and LMP2, and other ABV proteins leading to tumor promotion. Level of epidemiological evidence, high meta-analysis indicating high risk of lung cancer in ABV patients, ABV genome in lung cancer tissues in vitro models. Other is HIV or human immunodeficiency virus, potential mechanism of oncogenesis in lung cancer, immunosuppression, favorite tumor immunoscapes, level of epidemiological evidence, high meta-analysis indicates HIV patients have greater risk of lung cancer, 2.5-fold increase in the risk of lung cancer in PLWH who smoke. Other is CMV, cytomegalovirus. Okay, potential mechanisms of oncogenesis in lung cancer, PUL123, PUL122, and other CMV proteins induce entry to AIDS phase and cell cycle interregulation. Level of epidemiological evidence, low CMV genome found in lung cancer cells, oncogenic transformation of human embryo lung cell, or MB, potential mechanism of oncogenesis in lung cancer, invasion of BERH2, ubiquitation by MB phosphoprotein leader to negative regulation of P53. Level of epidemiological evidence, low expression of MB proteins in NCCLC. Okay, COVID-19 and lung cancer, the future challenge of research. The COVID-19 pandemic has had a significant impact on global health. A recently published article has summarized the possible oncogenic mechanisms of SARS-CoV-2 in the development of lung cancer. The possible damage of the virus to the lung causing pulmonary fibrosis, the hyperinflammation frequently suffered by patients with severe COVID-19, and the downregulation of angiotensin converting enzymes too could be involved in the possible development of lung cancer. The conclusion, the role of viruses in lung cancer development remains unclear but is supported by epidemiological data on infection in tumor cells, and through basic research studies have shown potential oncogenic mechanisms of viruses in lung cancer cells. Further research is needed. Tobacco smoking can contribute to viral oncogenesis by producing local immunosuppression and increased viral pathogenesis. Okay, thanks for your time.